Welcome to the BioBalance Healthcast, episode 696. Non-FDA approved meds are prescribed by thousands of doctors every day.
BioBalance Healthcast features conversations about anti-aging medicine. Your host is Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging. Dr. Maupin is the author of The Secret Female Hormone, the seminal work about testosterone replacement therapy for women, and Got Testosterone, the award-winning book for men that helps men choose the most effective and safe form of testosterone replacement. These books are available on Amazon or from Dr. Maupin's office at BioBalance Health in St. Louis and in Kansas City. Dr. Maupin's office is currently accepting new patients.
Welcome to the BioBalance Healthcast. I'm Dr. Kathy Maupin, and today I'm going to talk about almost a political subject, the FDA. You may not know it, but the FDA is paid by your tax dollars. The FDA surveils medications, but it also surveils the food we eat. It also has many other departments other than medications, and the FDA is very powerful. I wanted to talk about this subject because of something that happened last week, something that I think maybe some of you have thought the same things as my patient who confronted me about a non-FDA approved drug that I was prescribing for her. So I had an email from a patient who I had prescribed Armour Thyroid. Armour Thyroid and NP Thyroid are natural thyroid medication. They are from pork. They're from medical pigs. We use every part of the pig for different medical reasons. And for some reason, it has not been approved by the FDA. Part of the reason is it was around long before the FDA required research and studies to be done on every drug. There was a whole myriad of drugs that were out there before the FDA in the 1970s decided that they were going to not let a drug on the market until it went through their multi-million dollars worth of research. It's very hard to get a drug to market, and that's why one of the reasons why some of the medications that we use right now are so expensive. Because to get approval and to be allowed to distribute in the United States, you have to pony up a lot of money. Now, if you were taking a drug like Armour Thyroid, and it has been around since the 1950s, 1940s, before I was born, and it has stood the test of time. So it does not have any of the major side effects when used properly and dosed properly. We follow all the rules of the insert inside the Armour Thyroid. We still use the medication. But my patient was very disturbed because she went online and found out that the thyroid I had given her as a prescription was not FDA approved. That does seem to be worrisome if you don't know anything about the FDA and you don't know anything about this medication that's been around forever. If it was a bad drug, it would have been taken off the market. It's not. It has been successfully treating my female patients who have low thyroid for decades. And in fact, I started writing it for patients in 1986 when I went into practice because I was on Armour Thyroid. I had a wonderful doctor in Kansas City. When I was 20, my thyroid just stopped. And she treated me with Armour Thyroid. Then she said, women do the best with this medication, so I took it, and it worked. It took away all my symptoms of low thyroid. But as things happen, another drug called Synthroid came out and did go through the FDA approval process because it was new. And it is a synthetic Synthroid, a synthetic thyroid. So, excuse me, I'm going to turn that off. And because it's a synthetic thyroid, and because the FDA didn't didn't test any drugs except hormones on women before 2014, then Synthroid is the preferred medication. Well, Synthroid works beautifully for men. Of course, they were tested, and it worked for them when they were tested before it came to market. However, since they didn't test women, and they didn't realize that Synthroid does not treat effectively most women with hypothyroidism, and it doesn't treat me. I've tried it. It doesn't work. I mean, I get every symptom of hypothyroidism back when I'm on that drug, and my patients do too. Way back when I tried putting some patients on Armour Thyroid when they had low thyroid, and some of my GYN patients on Synthroid. And quickly I found that the Synthroid just didn't work for women. So I stopped even ordering that for women because it was so frustrating for them to go on a drug that didn't work for their problem. So this is just one of the things that is kind of not talked about very much in medicine. All of the medications that we had that were really good. Metformin wasn't approved by the FDA until 1990s. Metformin has been around for a very long time. It treats diabetes. It treats insulin resistance. It's low risk. It's basically easy to take, and it works. But it wasn't approved until the process was completed to get it approved, and that was long after it had been used for a long time. The problem with the question is, why doesn't Armour Thyroid or MP Thyroid go back to the drawing board and go through all of the tests to get it FDA approved? That would probably triple the price. I mean, and it is already a moderately priced drug. So to do that would cause many people to be unable to afford it. Here's also another little detail you probably don't know. In general, now this isn't true of Armour Thyroid, but in general, if the FDA does not approve a drug and it's still given to a patient, insurance won't pay for it. That's really devastating to a lot of people, especially if the drug is expensive and especially if the drug is something they need and there's nothing else. So I honestly was trained I came out of training as an OBGYN in 1985, and I went into private practice. Nothing in my training told me about FDA-approved drugs. I thought every drug was somehow approved by somebody, or they should be grandfathered in if they're safe, and they should be grandfathered in for FDA approval. But when I started out in practice, no one talked about this. There wasn't any internet. There wasn't any way to research things. But I wasn't given the tools in my medical training and my residency training to understand why I should prescribe one drug over another. Then I went into practice, and I found that many things that women need as a medication, and this is back in 1985, the 1980s, they didn't have an FDA-approved drug for that. They didn't have any drug for that. So many of the problems were PMS, painful intercourse after menopause, painful intercourse even prior to menopause, something called vestibulitis, which is a very, very tender, painful vulvar area, bladder irritability. They didn't have anything for that, and polycystic ovaries, and the polycystic ovary syndrome that caused infertility. There was nothing. So I started looking for an answer for my patients because I had all these patients and I didn't have an answer. I was not willing to say, there's nothing for you, see ya. I mean, that's what some doctors did, but I wasn't really happy with that, and I wanted to make my patients better. So I had a little trek through uncharted waters. I learned about something called compounding pharmacies and compounding pharmacists. We had a compounding pharmacist in our building when I was at Christian Northwest Hospital in St. Louis. And I decided I'm going to go down and ask him if there's anything we can do for these gals. And honestly, he knew so much about how to treat all of these vulvar vaginal problems, and he would make up a prescription compounded for the patient, because there's nothing FDA approved for it. This is not FDA approved, but it is compounded hormonal types of treatments. For PMS, back then they said PMS was a psychiatric or a psychological disease. It is not. It is just a lack of progesterone that makes you feel crazy. He would make up progesterone suppositories. Believe it or not, they worked. Then that turned into vaginal tablets over the years. Then that turned into creams and gels. We now have 40 years of experience with that. And it took 20 years for the powers of medicine to say that PMS is a lack of progesterone. And I'm not sure that they really wanted to tell us that. But now other doctors are now treating PMS with bioidentical progesterone. And now we have an FDA-approved drug for that called Prometrium. I'm not saying that I wouldn't use, if we didn't have something for a patient, I'm not saying that I would not use a non-FDA approved drug. Of course I will. I use Armour Thyroid on myself and my patients. It's very effective and very low risk. So I just think that there should have been an attention to women's illnesses that there wasn't at that time, and still really isn't. When we talk about hormones, just recently, they've taken the black box warning for estrogens, oral estrogens, there's a black box warning in the insert that you get with your some of your drugs. When you open it, there's a black box and it says, "Don't take if you have this," or they give the risks of that treatment. The FDA approves these inserts, even if the drug isn't approved by the FDA. Anyway, on all estrogens, there was a black box warning that said that you may have a blood clot, and that's only true if you take oral estrogen. And it also said that you may have breast cancer from the estrogen, and that's not true, and they've disproven that over time. I always knew that wasn't true, because half my patients who were on estrogen didn't have any more incidence of breast cancer than the patients that weren't on estrogen. And so if you pay attention and you do this every day, you see that it is your own research. And I saw that just wasn't true. And I knew that wasn't true, but one person was not going to change that. However, when I did treat PMS, I had an office full of patients because I was the first one. It took a lot of guts to do something that nobody else does in your city or anywhere. So I used progesterone. I stopped PMS, which stopped a lot of divorces and stopped a lot of conflicts, because hormone imbalances do affect your mood. So that was something that now the FDA knows and admits that it can treat that. They use it for uterine bleeding and some other things. We didn't have anything for our little old ladies who have not had estrogen in like 40 years, and their bottoms broke down. I've talked about this before, and they had bed sores. So we couldn't use the one FDA product that was supposed to be for women that would make the area around the vagina thicker so that it would withstand sitting, so it didn't turn into like tissue paper. So they had vaginal estrogen, which could be placed into the vagina, and that was for intercourse, but nothing for somebody who just had almost like bed sores because of their thin skin that they sat on all day because they were 80 and 90. So my pharmacist, Pete, mixed up some testosterone and Vaseline, believe it or not. testosterone powder. And he said, this is perfect because the estrogen cream, if we put estrogen cream on with a normal pH, which he could do, he said that might make some of them have breast tenderness, they might absorb it, and it might make them bleed. But this is just testosterone. It'll give them energy, it'll make them feel better, and the skin on their bottoms will get better. So I have been having my own personal fight with things that are not FDA approved, and the fact that we know that we need medications for a certain thing, yet nobody pursues that. And if something is a natural substance like testosterone made from yams or estrogen made from yams, which is the compounded basis of pellets and basis of creams that have estrogen or testosterone in them, they can't be patented. If you can't get patented, then you can't afford to go through the cost of the FDA trials. Therefore, you would just be throwing money away to get something approved that can be made in a compounding pharmacy. So that's the problem. Problem is, it has to be some unique drug or some unique delivery system for the FDA to actually approve it. So we do have issues currently with the thyroid. There's word out that thyroids and thyroid that is from porcine thyroid, which is from pork or pigs, and we can compound thyroid also and put it into a tablet that patients can swallow just like they do with the Armour thyroid or the NP thyroid. So they are trying to ban that. They're trying to ban the one thing that makes my thyroid patients who are female healthy. And this is what I tried to explain to my patient who thought I was giving her something dangerous because it wasn't FDA approved. It was around forever before the FDA started its trials. And some of the things that have been around forever that are generic, like estrogen, testosterone, progesterone, those things, nobody can afford to actually get it to pass FDA approval. That they need to change that process and they need to make it less onerous and less expensive. I don't know that will ever happen. I don't have hope. But they've also come out with a dictum in the recent past, maybe last month, that they are going to ban all peptides. Peptides are pieces of proteins, and we have thousands, millions of them in our body they are communication peptides. They are pieces of proteins that circulate in our blood that are usually communicating with a tissue to tell it to do something. So there are peptides that tell your thymus. Your thymus is behind your breastbone, and it gets smaller as we get older. But there is a peptide, thymosin alpha-1, that can be injected, and it will stimulate the growth of this very important organ when you get too old to have good immunity. One of the bad things about aging is our immune system tanks. Testosterone helps it, but sometimes some patients need help more with their immune system so that they don't get sick all the time. So I had some people who were immune compromised for some reason on the thymosin alpha-1. We can't get it anymore because the FDA has banned it. So no one, even compounding pharmacists, can't make it. And none of my patients can get it. So we have a problem. They know that it's safe. They know that it works for patients who have poor immunity or cancer. Because cancer is, if you don't know this, then cancer is something that is really not about the cell it comes from. It's about your immune system. If you get cancer, your immune system had a problem or does have a problem that let that cell just keep on growing and making a cancer. It's not about the cell itself. It is about the immune system. So thymosin alpha-1 is a really good injectable for people who have cancer or have been treated for cancer and don't want to get it back, and don't want to go through any more torturous treatments with chemotherapy. It's also good for people who have like a prostate mass that may be precancerous and they don't want it to become cancer. We've treated a patient who has gotten thymosin alpha-1, and his mass in his prostate disappeared on MRI. Then he went a year without taking it, thinking he was done. And then he went back, and on the MRI, there was another mass somewhere in his prostate. It was in a different place. It wasn't the same mass. So he started on the thymosin alpha-1, and I'm still waiting for the next MRI. This is a huge, amazing medication. There are many others. One can be injected into joints and helps joints heal. One can help Alzheimer's. It prevents the inflammation of the brain. And we don't have any other drug that's really patented to do that. It's really hard to patent something that's just a piece of a protein that we use as a drug. But the medications that we use for weight loss currently, so the Ozempics, the Mounjaros, those are peptides that are injectable that actually work like one of your peptide hormones in your body. So by banning any production of the same medication as is FDA approved, they stopped production of that. Here's what was wrong with that. Yes, we can get it in a pen that is FDA approved, but the pen costs $1,100 a month. They finally came down and said, okay, we're going to give you a vial that lasts a month with the lowest possible dose that lasts a month for $500. That's the drug companies. But the compounding pharmacies could make the exact same thing. You just had to draw it up and inject it yourself in a insulin needle. And 3 months is about $550. So it's a lot less if you have it compounded. They've just now banned that. There are some ways around it, but they have banned that. So basically, people who can't afford the medication for weight loss or diabetes that works so miraculously, they can't afford it. So their insurance won't pay for it. They're stuck. I mean, they shouldn't have to go into debt to treat their diabetes or to go from 300 pounds down to 150. This is a very effective medication. It always has been, even when it was just compounded by a pharmacy. So you can see the problem I have with the FDA is it limits what I can treat people with. It gives questions like, this is an FDA approved, I don't think I should take it. I mean, that question is a reasonable question if you don't know any of this. But to me, who uses it every day and takes it every day for my whole life, I find that to be, like a question that shouldn't have to be answered. It should be grandfathered in. And then you look at what's limited, the drugs that we don't have, the drugs that aren't available because the FDA has shut down the pharmacies that make peptides, or they've shut down their ability to make peptides. I don't know if they all went under, but I do know that that it has caused a lot of running around and trying to find medications that they used to make. The FDA uses multi-million-dollar pharmaceutical companies who do the research. Thank God they do the research. It's great, and they deserve to get paid for the research they do. But for some things that we already know that don't need research, and we've already been using them as compounded substances, or those drugs, they didn't test it on us. Some drugs we think are safe, they didn't test on women. They didn't test Ambien. They didn't test statins. Statins weren't tested on women. They were tested on men. They work great for men. Ambien works great for men. They don't work great for women. Ambien, you may remember, has a problem of causing women to have night terrors, sleepwalking, sleep eating, all kinds of different abnormal behaviors during sleep. But they would have known that had they tested women, but now they are, so I guess I shouldn't complain about that. Thankfully, I just had to wait like 40 or 50 years. I'm hoping that in the perfect world, they would allow the compounding pharmacies to do what they do, allow the pharmaceutical companies to do what they do, and keep the price down for drugs that aren't FDA approved. If you think that the drugs that are FDA approved are safer, think again, because there are many drugs that come out after all this testing and they find something terrible about them, like fen-phen. Fen-phen came out after it had already been approved through all this stuff, and they came out and said, we're going to take it off the market, because they did it after it had passed all the tests. So it doesn't mean it's safe if it's FDA approved. It just means that they haven't used it enough to find out what the problem is. So they didn't test on all the people. They didn't test on women until 2014. They don't grandfather drugs in that have been used forever and are very safe. They make people afraid of taking a drug that isn't FDA approved. And they are now going after some of the drugs that we need to treat patients that we can't get unless they're compounded, and they won't let the compounding pharmacies do that. This is something you can look into. All of the you can go to age-reversal.net/FDA/, and you can sign a petition to tell them to let the compounding pharmacies make the medications and the drugs that they make, and allow people to have affordable medication. I hope this helped you maybe know whether you're taking a drug that's not FDA approved and you know that it works. It didn't cause you any problem, but it is called off-label. So if you're taking a drug that's not approved by the FDA, it's just called off-label. That doesn't mean doctors can't prescribe it. Banning something, that means doctors can't prescribe it. So please help us get the medications our patients need, and sign on to that website so that you can give your side of it if you take any of those medications. Thanks for listening to me today. I hope this helped you in your choices of medication, and maybe I want to keep you from being anxious or having anxiety over something that is not necessarily FDA approved.
Email your questions or comments to podcast@biobalancehealth.com. You can find the BioBalance Healthcast on iTunes and on YouTube. For more information about bioidentical hormone pellet therapy and other reverse aging solutions, visit biobalancehealth.com or call 314-993-0963. You can find Dr. Maupin on Twitter @Dr. Kathy Maupin and on Facebook at facebook.com/biobalancehealth.